Hi, welcome to For Your Health, a show brought to you by Green Peak Alliance, a regional network that promotes healthy communities in East Central Vermont. I'm Elizabeth Kelsey. I'm here with our guest, Ryan Fowler. Ryan is a person in recovery. After working in addiction treatment and recovery for several years, he began focusing his efforts on harm reduction, public health strategies, and overdose prevention efforts. He's here today to share how we can prevent overdose deaths by responding effectively. Welcome, Ryan.
Yeah, thank you for having me, Liz. It's really an honor and a privilege to be here as a person in long-term recovery from a substance use disorder. I especially love what I do for work because I'm a person who's alive because of naloxone. Three different times first responders came into my life and reversed my overdose using naloxone, and because of that, I'm alive and healthy. And I come from a friend circle where many of us are here because of naloxone, and here to talk about how overdose death is 100% preventable with the right framework and understanding. And any overdose death is really somebody whose needs weren't met. But I can tell you a little bit about how to recognize an opioid overdose. Um, when we talk about an opioid overdose, we're really talking about lack of oxygen. Basically, an opioid overdose is when somebody takes too much of an opioid and that opioid depresses or slows down their brain all the way back to their brainstem. And their brainstem essentially stops telling their lungs to breathe. And so an overdose event is somebody not breathing essentially. So you're going to be looking for blue or pale or ashen complexion. Their breathing and pulse could be slow or stopped or erratic. They're going to have pinned pupils if you lift their eyelids because their blood pressure is reduced. So their pupils will be very small and not reactive to light. They're going to be unresponsive. They could be limp or rigid in some way, but not responsive. Their breathing could sound like a gurgling or snoring sound. And really what you're seeing is somebody who's unable to breathe.
And when we see that, what are the first things we should do to help someone?
When we see somebody in a situation like experiencing an overdose, it's important to remember that people make decisions based on their circumstances in life, and any human behavior is serving a purpose in that moment. And sometimes witnessing somebody who's self-medicating with opioids can be very difficult, and to see them in an overdose event can be really traumatizing and unpleasant for all parties. But in the event that you think that somebody is experiencing an opioid overdose, you want to know those signs and symptoms of an overdose that I went over. And you want to start with verbal stimulation. So yelling, something to get their attention. If they don't respond to verbal stimulation, you want to physically stimulate them. And you don't want to punch them in the face or shake them around too much because you could hurt them more. What you want to do is take your middle knuckles like this and rub their sternum and give them a sternal rub. And if somebody doesn't respond to a sternal rub, you really want to call 911 immediately and get medical professionals to check this person out. If they don't respond to either verbal or physical stimulation, you're going to want to administer naloxone. And what's important to know about Windsor County, Vermont, and throughout Vermont and much of the country, there is cost-free nasal naloxone known by the name brand Narcan available to anybody who wants to carry it. And so what you do is, in order to administer this naloxone, it's very easy. I carry mine like this, wrapped in a rubber band. You take open the package, you peel it open, you place this nasal spray into their nose, and after it's placed and they're facing upright and you know that this is going to go into their nose, you press the trigger. So peel it, place it, and press it. And when you press this trigger, all 4 milligrams of naloxone is going to go into their nose. It's going to hit their mucous membrane, go to their blood, into their brain. But that takes about 3 minutes to even start working, and it's going to seem like an eternity. So you're going to want to clear any crowds there may be around. When people wake up from being revived from an overdose, it's very unpleasant, and we'll get into that in a minute. But you're really going to want to clear a crowd and call 911. Best case scenario, if you have a protocol in place, you want to have somebody administering the naloxone, calling 911, and everybody else should kind of be clearing the area. And while you wait for 911, remember that this is a respiratory event, and all that the naloxone is going to do is reverse the effects of an opioid and give the brain the ability to tell the lungs to breathe. And in the meantime, you can breathe for somebody using rescue breathing.
Mhm.
And so part of the work I've been doing to update overdose prevention efforts is to include strategies that include teaching rescue breathing, because there's the risk of overdose of brain injury from overdose. And so it's important to be carrying a CPR mask to provide rescue breathing. And you simply just put the rescue breath mask over their mouth, cover their nose, and you're going to be blowing your oxygen into their lungs. One full breath, and you can do that every 5 to 10 seconds, and that's going to keep somebody alive and prevent brain damage. And if 3 minutes has gone by and they don't seem to be responding from the first dose of naloxone, each of these kits of Narcan come with 2 doses. And so after 3 minutes, you can give the second dose and wait for EMS to arrive, because hopefully at this time, somebody's called 911 and EMS is on the way. And when somebody does come back, it's important to let them know that naloxone only works for about 30 to 90 minutes, and it is possible to still overdose on the opioids that are in your system. And they're also going to be really sick, and it's going to be very unpleasant. You got to tell them that you don't want to use right away. You're going to feel better in about 30 to 90 minutes, because naloxone makes people feel very sick.
Yeah. Well, and it's really important to encourage them to get medical help even once they have revived, right? Because they could still overdose, right, with this in their system, with opioids in their system. Yeah.
Yeah, absolutely. And there can be a lot going on, and there is a Good Samaritan law in Vermont that protects people from prosecution for small amounts of drugs and paraphernalia at the scene of an overdose. So nobody should be afraid of calling 911 in the event of an overdose, because this could be a really complicated medical event. And just because something looks like something at face value, there's oftentimes a lot of underlying health conditions or mental health conditions that are preceding the overdose. And it's important to get professionals on the scene, but it's also important to carry naloxone and learn rescue breathing, because anybody can save a life. And right now, during the overdose epidemic, it's really important to respond and save people, because dead people don't enter recovery. And really, with harm reduction and practices like carrying naloxone, we can prevent 70,000 deaths a year in America. So I really appreciate coming on and chatting about this with you, Liz.
Yeah, we appreciate having you. And it sounds, for such a serious impact, a good impact, it sounds like such an easy thing to do. Everybody can carry naloxone, and it sounds fairly easy to obtain. Where can we look for? Where can we, you know, just average everyday people get naloxone and have it to be sure we have it on hand?
The easiest thing to do would be to call 211
Oh, uh-huh.
and ask what resources are available near you throughout Vermont. And also, it's important to become familiar with your local recovery centers. So in Windsor County, we have Turning Point, in White River Junction and Springfield. They're a really great resource for many things around addiction and recovery, including naloxone. Folks can get a hold of the agency that I work for, the HIV HCD Resource Center in Lebanon, New Hampshire. We serve Windsor County and Sullivan County and Grafton County and kind of the greater extending region. And we provide services to folks who are living with or who are at risk HIV and hepatitis C or viral hepatitis. And so we are able to give out a lot of naloxone, because we largely support people who are using drugs or are in some stage of addiction or recovery. And so to get a hold of the Claremont Exchange on the New Hampshire side for H2RC's harm reduction programs and access to naloxone, you can call 603-276-9698. And in order to get a hold of us on the Windsor County side for anywhere in Windsor County, you can call 603-448-8887, and that will connect you to our syringe services program and access to naloxone. And really, any healthcare provider can write a prescription for it, and your health insurance will pay for it. You can also access it at pharmacies, and it's really important to be asking medical providers and pharmacists, are they carrying naloxone? Are you able to dispense it without a prescription? Because many people are prescribed legal opioids and they're at risk for an overdose too. And so it's really important to make sure that those who are going to use the naloxone to save a life have access to it. And the person who's most likely to reverse an overdose with naloxone is a person who uses opioids, whether that's legal prescription opioids or illicit opioids like heroin or fentanyl. It's important to engage people who are most at risk for an overdose with harm reduction and healthcare services to give them access to naloxone. So it's really, again, an honor to come on the show with you, Liz, and talk about, my lived experience and how we can prevent overdose deaths in Windsor County, Vermont.
Thank you, Ryan. We really appreciate your joining us, and we will share some more information at the end of the show about some of those resources you mentioned.